Hi, friends. I'm Allie, an autistic therapist. I'm a licensed practicing counselor and national board certified counselor for the last 10 years working with the autistic community, their family of supports, and the community around them to help better understand the autistic experience and support their unique experience individually. Okay, today on our episode 14, we're making a huge pivot. This is the neurodivergent safe space, and today we are talking about autoimmune dysregulation. And I'm about to say something that blew my mind when I learned about it. I have read now over 70 studies. Yep, you heard that correctly. Over 70 studies about autism and the connection to autoimmune dysregulation. Now, I have read enough to conclude something specific. As I go through this, you may conclude your own thing. And certainly, our community has a lot of controversy over whether or not this is true. So, I'm going to make this statement based on what I believe, based on the research that I found today. And you get to make your own opinion. I believe, based on this research, that autism is also an autoimmune dysregulation disorder. I do not believe they are separate. I do not believe they are co occurring. I believe they are the same thing. They are additional symptoms of the same neurodevelopmental differences. That's a pretty huge statement I'm making. And that is a part of the controversy is that many of the research studies that I'm going to go through today are the positive side of what they believe. Yes, this is an autoimmune dysregulation disorder. Meanwhile, other studies have tried to disprove that, as all good science should. We should be actively trying to disprove something and have studies show up correct or incorrect based on that assumption. But what I believe is that autism is an autoimmune dysfunction. And so, what that looks like, I believe, is also going to be really unique to each individual autistic experience. And what that also means in terms of like, where are the biomarkers for that? Why has the community not supported this or expressed this? Why is this the first time I'm hearing this? Right? These are all questions that I also had, and I don't have answers to these because we have more studies in this one particular area of autism that is not included in the DSM. It is not included in the ICD-10, which is the medical manual. We are not seeing this conversation come up socially, except on social media when someone says, yes, I also have an autoimmune disorder. We're not seeing this conversation, but we have more research into this specific category than we do in any of the single DSM listed diagnostic traits for autism. Why is that? I do not have an answer for that. So we're going to bypass that question and why that is in the history of it. I'm going to let you guys do your own research and figure that out. Maybe you can inform me. I would love to learn. But what I do know is these are the studies that I'll present today and share with you a little bit about what specifically that means, what exactly autoimmune dysregulation means, and what that can look like for our autistic experience. Now, because every single time I make a statement that's broad that says autistics experience this, someone always comes back and tells me, Allie, it's a huge spectrum. Not everyone experiences autism like that. Correct. Are there going to be people who are unknowing that they also have some autoimmune dysfunction? Absolutely. Are there also going to be people who don't experience this? Absolutely. Are there going to be people who disagree with me? I sure hope so. I do not want to be an expert in this specific thing because I am relaying research that I have found for you and for our community as a discussion to open up about what this exactly means and what we want to do about it. So this episode 14 is going to be a little bit longer. Please bear with me as we go through this. I am really fascinated by this subject topic, and I believe in the next 5 to 10, maybe even 15 years, this is going to continue to be the primary research focus for autistic experience. Because if we can manage the autoimmune dysregulation, does that also mean we can reduce or manage more effectively the parts of the autistic experience that are more difficult and more challenging, especially for those with profound autism? I currently do not have an answer or a question for that, but I do believe and hope that that is our trajectory. So let's walk into what this means. And I want to first start with a study from in 1971. So we're going back way far. And that's pretty far study for autism research. Remember, we're only 100 years old as a psychology field. So going back to 1971, even though that's not actually that long ago, it feels like that long ago for autism research. Here's what was found by Money and their team. Autistic children have been known to have family members with multiple autoimmune disorders. So that's profound, right? It's not just an individual experience. In 1971, they also observed that family members of an autistic individual does also experience these autoimmune disorders. We also know, based on a study from Ashwood and Vanderwater in 2004, that 46% of the families studied with autism have two or more members with an autoimmune disorder. And the more autoimmune disordered individuals present within the family system, the number of autistic family members also increased. So there's some interesting connection there between the family members of those with autoimmune disorders and the individual themselves. And what's even further interesting is it does not have to be the mother. Moms in the history of autism have kind of a negative connotation. People often incorrectly assume that it's the parenting or it's the mother who is the problem that's caused autism, and neither of those things are accurate. Could there be a genetic link there? Sure, right? In the same way that it could be to the dad or grandfather or whomever, right? So we know that 46% of families with autism have higher prevalence of an autoimmune disorder within the family. The more autoimmune disorders present, the more autism is also present. We also know the specific autoimmune disorders that they're referencing here: rheumatoid arthritis, type 1 diabetes, hyperthyroid and systemic lupus, hyperthyroidism, Hashimoto's disorder, celiac disease. And there are many others that are also listed, and I will provide that research for you so you have access to it. So while the study of studies, so these are coming from meta-analyses, while the study of sounds really promising, there have been many assessments about the validity of some of the claims. And I believe that this is a part of why there's some dissonance between we have so much study because everyone wants to find a cause. We want to find the reason. We want to find the specific part of the brain that this is coming from, the specific biomarker, so that we can treat or manage or support or help or whatever it is, right? So the more we research, the more we come into bias. So when we start to say, okay, this is what I'm specifically searching for, then we start finding what we're searching for, but it doesn't necessarily make the research study correct. And so they're talking about validity here, that they believe that the validity of some of these studies was not very accurate. So do 46% of these families also have autistic family members? Based on these studies, yes. But overall, we're not entirely certain, to be completely fair. So what this group of studies, however, did identify is that autoimmune disease increases the likelihood of having an autistic child. So again, it doesn't have to be a direct link. It doesn't have to be from mom. And that comes from research by Hughes and their team in 2018. So we know that there is some connection between family, whether it's direct family of origin or whether it's extended family, having autoimmune disorder, also having children with autism. Now, in these sets of studies, it was not specific to any specific level, profound autism, higher functioning autism, none of that was included. It was simply a reality that if they were diagnosed autistic, they also tended to have a higher prevalence of autoimmune disorders within their family of origin. So for everyone non-autistic person diagnosed with an autoimmune disorder, 2 autistics are diagnosed. So that's more present research. We know that there is an enormous link to the autistic experience and also having personally an autoimmune disorder. Almost at that 1-to-2 ratio. Based on the study, the autistic population doubles the amount of cases of autoimmune disorders. And this is not autistic research. This is research done by the doctors and medical teams who are involved in treatment of those autoimmune disorders. And these studies have been from January 1st, 1976 through December 2000. So this research study was following 220 participants ages 3 and up. Their median average age of being diagnosed with their autoimmune disorders was about 13, meaning that we have seen in these 3 meta-analyses from Very Real, Valerial and their team in 2024, Ashwood Vanderwater in 2004, and Money and their team in 1971. We are seeing replicated meta-analyses with many participants identifying these direct connections to autism. Why are we not talking about this more? Why is this not something that is automatically being brought up in discussions? This is the highest cause potentially, or the highest connection, definitely, of autism with autoimmune disorders, right? So when we are getting diagnosed with autism, why are we not automatically testing our kids for an autoimmune disorder? Why are we ourselves not also assessing for autoimmune disorders? I don't have an answer for that. It needs to change, right? When we go in for evaluation, when we go in for diagnosis, we need to know the medical side of this just as much as the physical or mental, right? These two things, these bodies and brains of ours, do not exist separately. They are together and connected. And so when we are having dysfunction in one area, does it also mean we are having dysfunction in the other? It should always be assessed. So here's some more research. This is from Zhu and their team in 2020. Autistic children display higher amounts of antibodies reactive to anti-brain antibodies, anti-endothelial. I'm going to have to write that down later for you because I don't know if I'm pronouncing any of this correctly. So anti-endothelial cell antibodies, anti-nuclear antibodies, and anti-folate receptors, meaning that there are potentially up to 5 specific areas in the brain that can be directly impacted by the autistic experience, also having these autoimmune challenges and dysfunctions. And we've seen that, again, we're talking about research over and over and over, repeating some of these results. And an interesting link between prenatal autoimmune disorders, so things like Sjögren's syndrome, psoriasis. I'm going to butcher some of these names, so I'm going to stop there before I get worse. But in some of those prenatal autoimmune disorders, it was found to have a higher rate of ADHD symptoms and higher rate of ADHD diagnosis. Paternal inflammatory bowel disease were also associated with a higher risk of having a child with autism. So that was from Lee and their team in 2021, that part of the research. So again, we're seeing more and more connections here, even with ADHD isolated, that these spectrum challenges continue to be prevalent and pervasive. Adaptive immune response plays a major role in autistic development in utero. This is a study in 1982 from Wiseman and their team. If we knew in 1971 and 1982 that there were adaptive immune issues in the development of a child who was more likely than to be diagnosed autistic, why are we not connecting these together in infancy? Why are we not connecting these things as we get older, right? We should be assessing these from birth. We should be assessing these in utero. We should be assessing these things throughout our lifetime to assess how is it developing and changing. In a meta-analysis in 2022 of 154 studies, Robinson-Agramonte and their team found the following possible specific genetic factors and immunological disturbances in connection with autism. My friends, this study is enormous. I will provide a link to this in the at the bottom here, but you will have access to being able to read this. There are 22 specific ways in which the autistic experience and the autoimmune experience connect. They go together. It is really important to understand that I don't understand all this. I do understand the words. I do understand the concepts. And it's also really important to understand that there are many really nuanced parts of brain science here. So if you are super into brain science the way that I am, please go do your own research onto this. So I have tried to make these as user-friendly, comprehensive as possible. If I make an error here, I'm greatly apologetic, but I have tried my best not to. So number one, what are the aspects here from this meta-analysis of 154 studies? Number one, autistics have a loss of innate immune activation and or the loss of adaptive immune regulation and disturbed immune balance. That is 154 studies was done to find that autistics have a loss, so less immune activation and less adaptive immune functioning than others. That is enormous. Why is this not identified? There are literally more studies here than anything else in the DSM for diagnosis. We have 0 studies about how autism is actually a social cues challenge, but that's listed in the DSM. But we do not have that it's also specifically an autoimmune dysfunction. We have less autoimmune functioning within us. Number two, and this is a direct quote here, a higher concentration of pro-inflammatory or lower concentration of anti-inflammatory cytokines, I'm gonna mess that one up too, than healthy controls. What that means is that we have more inflammation and lower ability to anti-inflame, to reduce that inflammation down than others. That's enormous. That means even without autoimmune dysregulation, which is also in combination typically, by the way, think of that in parentheses here, autoimmune dysregulation is also exacerbated and created by inflammation. So we know that autistics especially have more inflammation and struggle more with those anti-inflammatory. We need those within our body to feel healthy stasis, and we do not have them very often. Number three, these symptoms are exacerbations of hyperactivity. Yep. Autoimmune dysfunction, pro-inflammatory and lower concentration of anti-inflammatory is also exacerbations of hyperactive behaviors. Does that mean that ADHD is also an autoimmune dysfunction? Yes, it does. This is why we see them overlap. It is why we see them have the most challenges. Number four, sleep disturbances and aggressive behaviors in autistic children have been found with those in higher immune dysfunction. Number five, there's a relationship between autoimmune disorders and maternal pregnancy and an increased risk of autism. So when our moms have autoimmune disorders or have flare-ups during the time of pregnancy, there's an increased risk of their child also experiencing having autism or experiencing an autistic experience. Number six, families with at least one child with autism tend to display a higher autoimmune burden, such as type 1 diabetes, thyroiditis, and maternal rheumatoid arthritis. Number seven, the risk of autism in offspring is particularly increased when maternal autoimmunity is in an effective phase when they're in an active phase during pregnancy, suggesting that an active inflammatory state during gestation may negatively influence the fetal neurodevelopmental trajectory. That's huge. That means we potentially have a cause here, right? Number eight, children with symptoms of irritability, lethargy, or hyperactivity have been shown to have higher release of pro-inflammatory cytokines, as well as lower amounts of anti-inflammatory secretion, suggesting an active pro-inflammatory state is required to exacerbate the behavioral symptoms occurring within the autism disorder. There's a lot to unpack there. What we know is that heightened increase of those pro-inflammatory cytokines help reduce the negative side effects, the specific things that we dislike the most about autism, that irritability, that lethargy, that hyperactivity, that intensity. We are more likely to experience those when we do not have those pro-inflammatory cytokines. I wish I could pronounce this correctly. That would help a lot. But those specific things that help us reduce inflammation. Number nine, experimental methods such as maternal immune activation, suggesting that pro-inflammatory response in the fetal environment can cause behavioral changes that last well into adulthood. So is it possible, based on this research study, it's saying it is possible that mothers who have maternal immune activation, they're currently in a flare-up, are more likely to have children with behavioral challenges that last well into adulthood. This is wild information. Number 10, there are elevated levels of specific parts of the brain that have been found in plasma of high-functioning autistic male children. Number 11, there is a co-occurrence of immune comorbidities that could, I'm going to try one more time. There's a coexistence of immune-mediated comorbidities that could utilize prednisone later in life, and there's a connection linked to more apparent behavioral conditions and the incidence of major disease severity. This includes allergies, type 1 diabetes, GI dysfunctions, inflammation, celiac disease, gut diabosis, obesity, seizures, and sleep disorders that are the most common comorbidities according to these behaviors in autism. So, what that specifically means is that when we have a child with, or even an adult or teen with the autistic experience also includes more difficult behaviors, they also tend to have a much higher prevalence of many of these autoimmune dysfunctions. Number 12, allergic diseases, including asthma, are more common in children in early life, showing a major disease severity and deficits of socialization that is directly also connected with the autistic experience. We will talk more about those allergies and asthma in a later episode, but I just wanted to touch on that today. Food allergies will also play a part in this. And number 13 here, food allergies may play a role in the GI dysfunction of autism. And although it remains controversial, some parents of children have seen a behavioral improvement after implementing diets without gluten or casein. We're going to talk about that in a separate episode specific to food allergies and the impact that has and what that means by changing their diet. But yeah, could we see behavioral problems from a child who's struggling with food disorders? Yeah, we see that with and without autistic experience included, right? Number 14, increased risk of allergies, including allergic rhinitis, atopic dermatitis, and I'm going to butcher this real bad, urticarial or type 1 diabetes and Crohn's disease are also increased risks for those with autism. Number 15, asthma and inflammatory bowel disease are higher rates. Number 16, gastrointestinal tract pathology is included. Number 17, local dysregulation of mucosal and immune responses and disruption to the intestinal barrier. All of these are included in a higher risk for autism. 18, alterations in the blood-brain barrier and deficiencies in gene expression of intestinal tight junctional proteins. Number 19, dysbiotic alterations in gut flora, altered bacterial metabolism. Number 20, maternal obesity may have an impact on brain development of fetal autistics. 21, during the highly dynamic neuroplasticity of prenatal fetal period, neural cells appeared to be highly sensitive to both genetic and environmental stress, which includes the autoimmune dysfunctions. 22, and this was kind of the summary here. In general, autism and Parkinson's disease are related to brain dysfunctions, and in their particular contents, genetic causes and risk factors play a central role in disease pathophysiology, severity, and disease progression, besides the overlapping immunopathology mechanisms and molecular pathways. Okay, we're going to take a deep breath here. That's a lot. There's a lot included here, okay? So we see from this enormous meta-analysis, again, of 150 different studies researched in 2022, that there are 22 different specific and combined traits of autoimmune dysfunction that are connected to and elevate the risk with and in conjunction to the autistic experience. Again, autism is an autoimmune dysfunction. In 2023, after a really complicated surgery, I personally experienced all of this. In my family, there are specific autoimmune dysfunctions that we have. I think when we sat down and calculated it on a small family tree, there are 7 of my extended family members who have significant or multiple autoimmune dysfunction disorders. And within my immediate family, I think we have about 3. I account for at least 3 by myself as well. So when we're talking about autoimmune dysfunction, listen, it's easy to say, oh yeah, they have that, right? The more profound autistics experience this, but that is not the case. It is regardless of the level or profoundness, of the autistic experience. So individuals between levels 1, 2, and 3 all experience this autoimmune dysfunctions and dysregulations. This needs to be a regular and included part of your medical treatment throughout your lifetime if you are also experiencing autism or ADHD. Simple as that, right? It needs to be included as connected. The majority of autistic adults I work with also suffer from autoimmune dysfunctions to the point that I regularly, routinely refer people to go see their doctor for updated blood work, checking in for autoimmune dysfunction or dysregulation. And we specifically talk about the connection between autoimmune dysfunction with autism and ADHD and the burnout rate. Because what we see with autistic burnout is incredibly enormous inflammation within the body and within the brain. It's actually been seen on brain scans, and we'll talk about that in another episode as well. So we can get more into depth on that. But what we see in that autistic burnout state, which causes things like regression, emotional shutdown, or emotional reactivity, or ongoing distress, or forgetfulness of skills, or loss of skills, or even a reduction in levels or increase in levels, right? All of those things we see from autistic burnout, literally all of them, are also symptoms of flare-ups during inflammation or during autoimmune dysfunction. So it's really important that we understand this connection of autism, ADHD, and inflammation and autoimmune dysregulation, because they are directly impacting how we function in this world. So one of my favorite jokes to tell, and this is truly a joke, my friends, is when someone hears about this and they kind of sit with it for a second, they'll ask me things like, okay, so what do we do about it? Right? Now that we have all this really cool information, what do we do with it? I don't have a clue. I don't have a clue, right? My joke is that give them Tylenol, let's reduce the inflammation, give them some ibuprofen, reduce the inflammation in the body. Does that make the symptoms go away? No. Yes. I don't know. We do not have an answer for that yet, right? We do not know what to do with this information yet, because the way that our medical system and mental health systems are set up is this still looks like co-occurring issues, right? We don't have prevalence data on it. We do not know how many people are actually suffering this. We just know that there are many, 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 many studies that are saying, yes, this exists. And there are, several studies also saying, no, it doesn't. Here's why. Here's my proof. Here's my evidence, right? So we see on both sides that this exists. Let me tell you, that body of information that says this doesn't exist is significantly smaller than the body of research that is saying, yes, this does exist. I do not know why it's not being talked about. I do not know why it's not being treated together. But what I do know is that our medical system doesn't function as a whole person, right? If we go to the hospital and we say, oh, I'm having some chest pressure. This just actually happened to me on Thursday. I got sent to the ER. I went in, I said, I think I'm having an asthma flare up. And they checked my lungs. They listened to my breathing, said, no, you're not having an asthma flare up. And I said, well, it's hurting pretty bad, like right here and right here. This is what's going on. And I was like, it's been going on for a couple of days, so it's kind of weird. I was sent to the ER to have full workup on my heart because it sounded like a blood clot in my heart. 2 hours later, they said, absolutely not, sent me home. This is not what's going on. What they didn't check for in that x-ray, they did an x-ray of my heart specifically. They didn't check the small capillaries of my lungs to determine specific details of asthma. And they also didn't check anything else, including heartburn. What I was having was heartburn, right? Which is kind of an embarrassing problem when they're looking for major trauma or major emergency, and I'm having easily managed heartburn, right? But that is a part of how our medical system works. When we get one thing stuck in our heads, we go one pathway here, go see the cardiologist, go see the endocrinologist, go see the rheumatoid arthritis doctor, right? Go see the specific doctors for the specific problem, but none of them treats the whole person. Theoretically, our DOs, and we do have some amazing doctors in our systems who do see the whole person, and our primary care physicians and nurse practitioners often try to do this whole person awareness. But that's not how our medical system is coded, and it's not how we bill for things either. So if someone comes in and says there's a whole lot of problems, we got to use 4 or 5 different codes in order to explain that you're just experiencing normal life stressors and inflammation in your body, right? So do we have great answers for how to do this? No. But what our pediatricians should need to know is that when a child is suspected of having an autistic experience, they should also be blood tested or specifically assessed throughout their lifetime for autoimmune dysfunction and inflammation. We also know there are really upcoming interesting research studies being done on GLP-1 specifically to manage that inflammation and to manage many of the autoimmune dysfunction or dysregulation disorders as well. And so potentially in the future, maybe we find that a GLP-1 or some of these similar medications can also provide some inflammatory supports and a reduction in additional symptoms that cause distress. Yes, those are upcoming research that we are actively ongoing pursuing and actively assessing. So let's take a pause for a second and think about what we've just talked about, because this was pretty enormous. We do not need to make any major changes to what we're doing day to day to understand this information. But we should consider it, especially if we find our bodies consistently and repeatedly struggling. And we should consider it with our children to assess what's going on. Now, some disorders we may not have answers for. Some autoimmune dysfunctions we do not have support for or help from. But if we get something like an autoimmune disorder like PANS or PANDAS, and I'm going to explain more about what that is here in just a second, when we have those kinds of autoimmune dysfunctions, especially in our pediatric populations, there are specific things that can be done. Now, what is PANS and PANDAS? Pediatric acute onset neuropsychiatric symptom, PANS, or pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. So an autoimmune disorder, encephalitis, or inflammation of the brain, which occurs abruptly within a short period of time after a streptococcal infection, includes at least one other neuropsychiatric features such as motor abnormalities, sensory sensitivities, or urinary symptoms, and are not better explained by another medical condition. And that comes from the ICD-10. So the medical diagnosis here of what that is. There's significant association between PAND and PANDAS and autism. When we get down to the specific autoimmune dysfunctions, we do have research studies discussing those specific prevalence data. So for example, in this study, they were able to identify that 43.6% of children with autism also met criteria for PANS, and 31.3% also met criteria for PANDAS. So we know, I mean, these are 43.6 and 31.3%. These are high statistics. These are intensely higher than some of the diagnostic traits for mental health on the autism side. So symptoms of PANS and PANDAS also that are similar to the autistic experience, because they are tics, which can appear abruptly and severely, heightened anxiety, emotional outbursts, irritability, behavioral regression, sleep disturbances, urinary issues like incontinence or frequent urination, unusual sensory and motor responses, and loss of appetite. These are also seen in autistic experiences. Again, does it mean that every child with autism also has PANS or PANDAS? It does not. Does it mean that a high prevalence does? Yes, it does. We should be checking our kids for autoimmune dysfunctions when we are getting an autism diagnosis or we suspect autism, because we all know that autism exists well before that diagnosis occurs. What it also means for my adult population, especially my young adults who feel real crummy, is that check with your doctor, assess for anything that could be autoimmune related to see if a part of your difficulty or challenge at present is an autoimmune dysfunction, because in some cases we can treat the autoimmune dysfunction and then we can see you functional again in order to be able to work, in order to feel more functional as a human being, in order to reduce some of the distress that comes from these symptoms. So this is a lot of information I have thrown at you. I will share a lot of these studies for you to review for yourself and explore more. In fact, today I'm not going to talk a whole lot about on the episode of this. I'm not going to, the write-out, excuse me. I'm not going to share a whole lot of the specific insights I've come from, because I don't have a lot of insights on this. To me, this is pretty black and white. What I am going to do is share with you all of the references so you can do your own research study into this and learn more about it. But it is important to me for you to understand and for me to comprehend for my own life and for my children's lives that autism is, and so is ADHD. Autism and ADHD are autoimmune dysfunctions with inflammation. Thank you so much for joining me for podcast Neurodivergent Safe Space on our episode 13 of inflammation and autoimmune dysfunction.